All right, we're good.
Hello, everyone. In today's debate, we will be discussing the topic of gift giving within applied behavioral analysis. Before we begin, I'll start off by introducing the group that includes myself, Jasmine Amores. Alexa Simon will be the fielder and the illustrator. Janelle Humphrey will discuss the counter-argument of why gift giving is not acceptable, while Katie Tompkins will be discussing why gift giving should be acceptable. Last but not least, our summarizer for today is Giselle Valencia. However, due to video restrictions in Dubai, we will be playing pre-recorded videos through YouTube during her part of the debate. We have decided to present gift giving through an informal debate where we will first share the counter argument, which does not support gift giving, and behavioral analysis should follow ethical guidelines. And then we will discuss the point argument that gift giving should be okay and should not follow ethical guidelines. And to begin with, gift giving is a form of verbal and nonverbal communication with or without tangible items from one person to another. It's a universal language where giving something is done as a good gesture to say thank you or to show appreciation. Whether it's someone's birthday, graduation, the holidays, or just as a thank you, gift giving usually occurs within these situations. In the field of ABA, it is considered inappropriate for therapists to accept any gift to ensure that they are following ethical guidelines. The Professional and Ethical Compliance Code 1.06 A through C states that behavior analysts should avoid multiple relationships due to harmful effects that might occur and should seek to resolve those issues. It is a behavior analyst's duty to recognize these situations and make sure to inform clients and therapists about their boundaries. Therefore, 1.06D states that behavior analysts should not accept any gifts from a client or give gifts to their clients. Gift giving can cause a dual relationship even if it is not intentional and should only pertain to conducting evidence-based treatments to clients. In our book, Ethics for Behavior Analysts by Bailey and Birch, they explain how gift giving can begin a slippery slope towards a dual relationship. For example, a mom giving a gift to a therapist now might consider asking for something in return in the future. Something in return might include being flexible with billing, being asked to stay longer for a session, or even asked to babysit. Some examples of gift giving include therapists receiving a small birthday card, being offered food, receiving gifts, and even being given water or baked goods by clients or their parents. Gift giving also includes therapists giving clients gifts that includes like new Lego sets, bubbles, Play-Dohs, etc. Whether you're being given a gift at large worth up to $50 or even small gift less than $10, the main purpose of the Ethical Code 1.06D is to prevent therapists of having a dual relationship with their clients and their families. When therapists are given gifts worth more than $10, then they are faced with uncomfortable situations of needing to deny gifts. I know there are many of us that can relate where we have been in the homes of clients and have been offered to stay for dinner by parents or during the holidays where it's the season of giving, that we have been in situations to deny items from the clients. While accepting or giving gifts is a way to express gratitude and appreciation for the types of services we provide for clients and promotes a good standing relationship, behavior analysts should understand that gift giving can create multiple relationships and should avoid receiving or giving gifts towards clients and the families. We will now begin with Janelle, who will discuss the counter argument of why gift giving should not be considered and why we should follow the ethical guidelines of 1.06D.
So as stated by Oots, Poles, Tompkins, and Willems in the opening gift, social inclusion, professional codes, and gift giving in long-term mental health care, gifts can be broken down into different types, including a symptom gift, a compensation gift, a courtesy gift, and a personal gift. A symptom gift is given based on the beliefs of the giver, such as feeling insecure and wanting more people to like them, and therefore the underlying reason behind giving the gift should be analyzed. A compensation gift is given due to its monetary value to render for services provided. This can cause an expectation of reciprocation due to the professional being seen as in debt to the giver. This could cloud professional judgment and creates the risk of giving preferential treatment to the gift giver. A courtesy gift is intended as a thank you to the professional because they do so much for them. As professionals, we are trained to do so much for our clients. We are already getting paid to do this, and accepting a gift as a thank you is almost like being double paid for our job. Finally, a personal gift is when the gift is chosen because it relates personally to the professional or it is uniquely appropriate to the professional. Accepting gifts in any of these categories can cause an over-personal relationship with the gift giver or client, and thus a multiple relationship.
All right, I'm going to screen share and show you some examples of the types of gift that you just talked about. First up was the symptom gift. An example of this could be an apology or a simple bid for attention, but a lot of the time it's not very straightforward. So professionals must always remain cautious and adhere to the ethical codes. All right, and these are compensation gifts. This gift says, here is some extra for your services. And this can leave the professional feeling indebted, therefore creating a multiple relationship. And these can be things like gift cards or gifts that are worth a lot of money. And then, so this would be a courtesy gift. It is a physical representation of saying thanks. Regardless of how small and simple it may seem, this and any kind of gift could cause misunderstanding regarding professional relationships. As behavior analysts, it is our duty to serve the client in the most meaningful, unbiased, and respectful way possible. Being it is required, tokens of thanks are unnecessary. You're just doing your job. And then last, we had a personal gift. Therapists, especially ABA therapists, spend a lot of time around clients and their support team, for example, parents, siblings, or guardians. Eventually, they're going to find out something about you besides being solely a professional. For example, they might find out that you like bacon and exercise often, hence gifting you the only BS I need in my life is bacon and squats t-shirts. Even if you do, in fact, love bacon and squats, it is important to acknowledge that it is a personal gift, and accepting it would be breaking the professional code of conduct.
So due to these different types of gift giving, the giver and receiver may have different views of the relationship, and this could cause ambiguity in professional relationships. Relating to Ethical Code 1.06, multiple relationships and conflicts of interest, accepting gifts could constitute a conflict of interest, possibly in the form of preferential treatment to the clients who give gifts. Furthermore, Ethical Code 1.05, professional and scientific relationships, states that behavior analysts provide services in a defined, scientific, or professional relationship role. Having an overly professional relationship doesn't fall in a professional relationship role. Next, according to Katz, Kaplan, and Merz, in All Gifts Large and Small, toward an understanding of the ethics of pharmaceutical industry gift giving, as humans, we have a tendency to engage in networks of obligation. In other words, when a gift is given, oftentimes the recipient has a sense of indebtedness, and thus can lead to reciprocation, which is strictly advised against in the Ethical Code 1.06, multiple relationships and conflicts of interest.
All right, I have one more thing to show you regarding the cons of gift giving.
What just happened?
What?
Nothing.
Okay. So this is a sample illustration of the cycle of gift giving. Once the process starts, it's hard to break and can cause ambiguity in the therapeutic relationship. Gift giving can turn into an obligation, whether it is conscious or not. Therefore, the cycle of gift giving and receiving and giving in return is started. It may seem innocent, but as stated in the code, it creates multiple relationships.
Ethics for Behavior Analysts by John Bailey and Mary Birch makes relevant points regarding this cycle. Did you write this? Because I did not.
Oh, yes. Sorry, I didn't copy and paste it into my notes. Sorry, I lost my place now.
Well.
Sorry, I'll just read it from here. Okay. The Ethics for Behavior Analysis by John Bailey and Mary Birch makes relevant points regarding this cycle. Behavior analysts have received team logo caps, sports events tickets, books, DVDs, expensive wine, baby gifts, new CDs, and loaded gift cards. Exchanging gifts creates a dual role relationship. The client and the behavior analyst now become friends, and the BCBA is expected to return the favor at the right time. Ethics for Behavior Analysts also mentions having the parents or guardian sign a declaration of professional practice in which the expectations are described before services begin in a good way to lay the groundwork for ethical service provision. Sorry about that.
And the next part is you too, I think.
Yeah, sorry. I don't know why it's all separated. I wasn't on my initial notes or my printed notes. This feeling of obligation to reciprocate happens when any size of gift, either large or small, according to Katz, Kaplan, and Merz, also influence clinical judgment. In other words, accepting gifts can cause ambiguity in a relationship and cause a blur in the lines of a professional and scientific relationship, which goes against Ethical Code 1.05, professional and scientific relationships.
Finally, according to Sean A. Spence in Patients Bearing Gifts, are there strings attached? There are meanings behind giving gifts. For example, when a gift is given from a client, that shows the client was thinking about their clinician or their professional outside of just during the services time. This shows the professional persists in the client's mind, and thus, relating to Ethical Code 1.06 can cause a multiple relationship, and relating to Code 1.05 is not a professional or scientific relationship. Historically, gifts are seen as a fee for services rendered, or something given with a corrupting intention by the gift giver. As stated earlier, we are already getting paid to do our job by our employers, and accepting a gift as a fee for services rendered is almost like being double paid for our job. Furthermore, if gifts are accepted, it may foster favorite clients. It is important to maintain justice and equity for all clients, regardless of whether or not they can afford a gift. If a favorite client arises, or in other words, a multiple relationship, which relates to Ethical Codes 1.05 and 1.06, the professional can no longer remain impartial towards providing services, and thus critical judgment of the client may no longer be possible. Ethical Code 2.09, Treatment and Intervention Efficacy, relates to critical judgment not being possible. We have an obligation to provide the most effective treatments and interventions possible, and without critical judgment, those treatments or interventions may not even be considered. Spence states that gifts from patients should never be accepted because they may conceal unconscious motives, in which case the underlying motives for the giving of the gift should be looked at. These articles have some limitations as well as some criticisms to take into consideration. All of these studies take place in other professions outside of behavior analysis, such as pharmacology and in the medical field. However, they can all be related directly back to behavior analysis. We as behavior analysts provide services to clients just like the other professions do. Furthermore, these articles are not empirical studies about gift giving, which could also serve as a limitation.
So in ABA, practitioners tend to do much of their work in clients' homes and with their families. Do you think that denying a small token of thanks could have a negative effect on the therapy provided?
I do not think so. If you are upfront with the client and their family and have open communication about why you cannot accept the gifts, I think negative effects can be avoided.
The article you mentioned by Utz, Poles, Tonkins, and Willems classifies gifts into different categories and levels. Going beyond the types of gifts they explained, do you think that a system for classifying gifts could be beneficial in the field of ABA?
I think that classifying gifts by types can help with identifying further what the client may need. The reason behind the gift giving needs to be looked at and then dealt with.
Okay. If an ABA therapist were offered a bottle of water or a snack during a session, would that be considered a gift? And if not, where is the distinction between it?
Yes, I think that this would be considered a gift because it is something that the client or the family would be giving to the therapist.
All right. And what might be some aversive consequences that can occur if you do accept a small gift, like a glass of water or a $5 gift card?
If a small gift is accepted and down the line the client or family is unhappy with the services that are being provided, the client or family would be able to hold that gift over your head and could also expect some sort of retribution.
So what are some preventative strategies that you could use to help your clients, including parents or others, not offer to provide you as a behavior analyst gifts?
Before services begin or at the very beginning of the services, you could explain to the client and their families why gift giving is not accepted in behavior analysis and what the ethical code says in layman's terms so that they can fully understand it. It is important to be clear and upfront and to have open communication about this topic.
Okay. All right, and then this is just this part, which we will cut and paste into it. All right.
So although we have to abide by ethical guidelines and ensure that behavior analysts are not partaking in any gift giving, Section 2.0 in the Ethical Compliance Code states that behavior analysts has a responsibility to operate in the best interest of their clients. This means that it is important that behavior analysts should consider their clients and their families' well-being when being offered a gift to show appreciation towards their therapist without having a multiple relationship with one another. Katie now will discuss further the pro side of gift giving, of why it should be okay to accept gifts and why we should not consider following the ethical guideline of 1.06.
The first study that I'm going to discuss is an article by Brown and Trangsrud 2008 called Factors Associated with the Acceptance and Decline of Client Gift Giving. The purpose of the research was to determine in which situations and what types of gifts therapists would accept or reject a gift. The authors asked 4 questions to 40 licensed psychologists who were currently practicing and also held a PhD. After being given the scenarios, the psychologists would indicate whether or not they would accept the gifts and list their reasons for their decisions. The gifts varied from tickets to an event to an engraved watch. Out of the 4 scenarios, there was one gift that a majority of the psychologists stated they would accept. The gift was from a 40-year-old Native American woman given at the end of her treatment with her therapist, and the gift was considered to be an honor in her tribe. The psychologists believed that they would accept the gift because they believed that they would need to be sensitive to the client's culture in that situation. The client was sharing gratitude, the gift was inexpensive, it was at the end of the client's therapy, or because they did not want to hurt the relationship. For the other 3 scenarios, participants believed they would not accept the gifts because of their high cost, sentimental value, they felt like they were being manipulated, or because it was the middle of their treatment phase. The article states that the American Psychological Association believes that psychologists may need to adjust their treatment to meet the cultural needs of their clients.
Okay, we're going to go back to the slides. Okay, so this is whether to accept or decline a gift. The central purpose of whether to accept or decline a gift should be to preserve the therapeutic relationship. Gifts in low monetary values, such as pens, gum, or a candy bar, may pose little risk of professionalism being compromised. In comparison, if a gift is worth a lot of money, it is reasonable to decline. If it is the last time the client will be seeing the therapist, it may be reasonable to accept a small token of thanks. Cultural sensitivity also comes into play when accepting or declining gifts. Often, clients are already isolated, so it may not be beneficial to decline a gift if it would be alienating, especially if it were something like a drawing or a thank you card.
Similarly, according to the Behavior Analyst Certification Board 2014 Ethics Code 1.05e, behavior analysts will work to avoid behaviors that could be considered demeaning to a person's culture. The authors conclude that there are several factors that go into accepting a gift, such as cultural sensitivity, fear of alienating the client, denying a gift because of its monetary value, or perceived harm to the therapist-client relationship. However, it is important to make a decision that is both ethical and in the best interest of the client. The participants believe that they were able to make that decision without needing to ask the client, simply based on the gift and the condition under which it was given. Hahn, 1998, suggests in his article, Gifts in Psychotherapy, an Intersubjective Approach to Patient Gifts, that both the therapist and the client or patient need to be a part of the therapeutic process. This means that denying a gift from a patient could potentially damage and lead the client to feeling rejected. The author suggests an subjective approach to accepting gifts, and that gift giving can lead to increased opportunities for improving the therapeutic relationship. The intersubjective approach recommends seeking to understand the purpose or intentions behind a gift. This would include asking the client or patient about the gift and where the idea came from. The author goes on to describe case scenarios and how therapy can be facilitated after a practitioner accepts a gift. Han also presents scenarios where therapeutic relationship was harmed because of a rejection of a gift or a therapist considering whether or not to accept the gift. The article states that it would not be fair to expect the client to never wish to make that connection, and forcing a therapist to deny that attempt could hurt the client. Doing so would go against the core ethical principle of treating people with care and compassion and the BACB Ethics Code 2.0, which states that it is the duty of behavior analysts to do what is best for their clients. A therapist may not be acting ethically if they are engaging in a behavior that is harmful to their client. In the article, The Price of a Gift, an approach to receiving gifts from patients in psychiatric practice by Brendel, Chu, Radin, Lieber, Pope, Sampson, and Bodkin, offers somewhat of a solution by presenting a case study with a list of questions therapists can ask themselves before accepting or declining a gift, and follows up with case scenarios that represent the typical gift-giving situations that therapists face. The questions are: does the gift harm the client and benefit the practitioner? Does the gift have a high monetary or personal value? Does the gift have a high value to the practitioner? Would the gift be acceptable to others in the profession? Is rejecting the gift going to impair the therapeutic relationship or help facilitate it? And finally, is the therapist making these decisions with the client's best interest in mind? The authors conclude that these decisions need to be made on a case-by-case basis and that there is no one-size-fits-all. The BACB Ethics Code 2.09a tells us that we need to have an individualized treatment for our clients and patients, and gift giving could be addressed in the same way. Additionally, this could also go against Code 4.07 by creating an environment that could inhibit a client's treatment if a client has their feelings hurt due to a declined gift.
All right, I want to pull up a slide that pretty much just goes over what Katie just said. Regarding the questions to ask when accepting gifts, from the article by Brendel, Chu, Radin, Lieber, Pope, Sampson, and Bodkin. And when it comes down to it, the client's well-being and success should be on the forefront of all practitioners' minds, and every question should be scrutinized. If necessary, it may be beneficial to speak with other professionals to determine whether or not to accept a gift, as long as doing so is not limited in your professional code of ethics, like it is with behavior analysts. Most professionals agree that gifts of high monetary value should not be accepted, which addresses the first question because the gift may be exploitative. To reiterate the questions to be contemplated, they are: would accepting the gift be exploitative, meaning that it would benefit the clinician and possibly harm the patient financially, emotionally, or otherwise? The second question asks if if there's a great monetary or sentimental value to the patient, the clinician, or others in the community. The third question asks, is the gift extremely valuable or desirable to the clinician? If so, the clinician must reflect carefully on whether his or her judgment or performance would be compromised by accepting it. 4, would accepting the gift run counter to the professional norms in one's practice community? Would the declining the gift be hurtful, traumatic, or otherwise counter-therapeutic to the patient? Is the clinician's deliberation about accepting or declining gifts guided primarily by consideration of the patient's best interest?
Some limitations include that the studies were not based off of the field of ABA, So it is unclear how a BCBA or an RBT would respond. Since behavior analysts typically have different relationships with their clients than traditional therapists do, this approach would need to be adapted to working with clients in similar contexts. The authors also do not provide suggestions for when gifts are too expensive, inappropriate, or when accepting a gift could potentially harm the patient in the long run. Some of the scenarios also do not indicate how the therapeutic relationship might unfold after accepting or declining a gift.
So what happens if a parent gives you a small gift that you accept, but 6 months later decides the parent decides they are unhappy with services you're providing and starts to seek out retribution?
Parent retaliating months after being accepted, after a gift being accepted, most likely would not be due to the gift itself, but instead an issue related to the treatment or another factor.
So to what extent is gift giving appropriate? Where is the line between a professional relationship and a friendship when it comes to gift giving?
Gift giving would be appropriate as much as it is socially appropriate. Boundaries would need to be communicated if the gift giving becomes inappropriate, and a therapist would still need to be aware of dual relationships. Additionally, the other codes would still apply to ensure that behavior analysts are being ethical.
So do you think there's a potential bias for favoritism, even if it is unconscious, after receiving gifts from clients?
There is always a potential for bias. However, most people in the field of applied behavior analysis are not there for the gifts.
Do you think that the BACB ethical code should be altered to allow gifts to be given or received? And what should it state instead, if so?
The code could include some guidelines and boundaries for accepting gifts, such as maybe setting a price limit. This could also be at the discretion of the BCBA in charge of the case.
And then it's Giselle's part, right now. And then to you, Jasmine.
So thank you all for watching our debate. Gift giving is an important aspect to consider in the field of ABA due to the harmful effects of creating dual relationships with clients and their families. Although gift giving is socially acceptable and naturally occurs to show gratitude and appreciation, the Ethical Compliance Code section 1.06D does state that we should not accept any gifts or give any gifts to clients because it constitutes a multiple relationship. Therefore, we should consider informing parents in the beginning of services of what is expected to avoid any miscommunication and to prevent therapists from feeling uncomfortable to deny or return gifts. Overall, behavior analysts should ensure professional and quality services and should not expect anything more than a thank you from their clients and their families that they work with. Hope you guys all enjoyed. Thanks.